Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. ADHD versus Autism. What's the difference? The difference between attention deficit hyperactivity disorder, ADHD, and autism is generally seen in conversations and interactions with others. People with ADHD may interrupt and blurt out remarks, while people with autism tend to have difficulty making eye contact and showing empathy. /r/n/r/n. Despite their differences, these two neurodevelopmental disorders also have several symptoms in common. For example, people with autism and ADHD may both be impulsive and easily distracted. Children with both disorders may develop speech later than is typical for their age. /r/n/r/n. An adult or a child can have both ADHD and autism. When that happens, it's important to recognize and treat both disorders appropriately. /r/n/r/n. ADHD and autism are two separate conditions characterized by different symptoms. /r/n/r/n. Autism is usually detected earlier in life than ADHD. Autism can be recognized before a child reaches 3 years of age, while ADHD is diagnosed at an older age. /r/n/r/n. Children with ADHD may be easily distracted, have a difficult time paying attention in an academic setting, lose their belongings, and have problems focusing. These children tend to be boisterous and talkative. /r/n/r/n. In contrast, children with autism have a hard time interacting and communicating with others and may develop repetitive behavior and poorly coordinated motor function. These children tend to avoid social contact. /r/n/r/n. Speech delays, unusual speech patterns, or lack of spoken language. /r/n/r/n. Difficulty with social communication and social interaction. /r/n/r/n. Repetitive behaviors such as rocking or pacing. /r/n/r/n. Sensory challenges, under or overreactive to light, sound, taste, smell, touch. /r/n/r/n. Inattention, difficulty focusing and concentrating. /r/n/r/n. Impulsivity, likely to blurt out remarks or take inappropriate actions without thinking about them. /r/n/r/n. Hyperactivity, having excess energy or moving and talking too much. /r/n/r/n. ADHD can continue into teen and adult years. Adults with ADHD may show inattention by making seemingly careless mistakes or having problems listening closely or following instructions. Hyperactivity and impulsivity may be expressed as extreme restlessness, fidgeting, excessive talking, and interrupting or intruding on others. /r/n/r/n. Autism affects adults as well. Adults with autism may feel awkward in social situations and prefer to be alone. They can have rather blunt responses in conversation and may take things literally. They like to stick to the same daily routine and can have difficulty making friends, making eye contact, and expressing empathy. /r/n/r/n. Very well, Michela Buttignolrnrn While the symptoms of ADHD and autism may not look the same on paper, they can look very similar in person. /r/n/r/n. Traits like distractibility and impulsivity, for example, are part of the ADHD diagnosis. While they're not part of the autism diagnosis, they appear in most people with autism. /r/n/r/n. While ADHD and autism share some symptoms in common, the symptom overlap usually works in only one direction. It's pretty common for people with autism to have ADHD symptoms, but it's relatively rare for people with ADHD to have symptoms of autism. /r/n/r/n. Here are some of the symptoms and challenges that people with ADHD and autism often share. /r/n/r/n. It's important to note that these symptoms, while they look similar, may result from different causes. For example, social challenges in autism may result from a lack of imitative speech or body language skills. By contrast, social challenges in ADHD may result from impulsivity, taking control, or an inability to conform to group expectations. /r/n/r/n Both autism and ADHD are described as neurodevelopmental disorders in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. /r/n/r/n The descriptions of the two disorders don't overlap at any point, so it would be reasonable to conclude that they are entirely different from one another. In fact, until 2013, it was not possible to diagnose both autism and ADHD in the same person because the DSM criteria didn't allow for simultaneous diagnosis. /r/n/r/n In 2013, however, dual diagnosis became an accepted practice and the number of people with dual diagnoses grew. The Centers for Disease Control and Prevention, CDC, notes that about 14% of children with ADHD also have autism diagnoses, though some estimates are much higher. More than half of children with autism may have symptoms of ADHD. /r/n/r/n Researchers are still in the process of figuring out what causes autism and ADHD. There is no doubt that both ADHD and autism are heritable, meaning that they run in families. That means there is a genetic component to both disorders. There are also some environmental issues that can lead to autism, ADHD, or both. /r/n/r/n Researchers are exploring how differences in brain structure and chemistry may cause autism, ADHD, and other developmental disorders. /r/n/r/n Besides genetics, risk factors for ADHD include /r/n/r/n All of the risk factors of ADHD except brain injury are also risk factors for autism. In addition, autism may be caused by specific genetic developmental disorders such as Fragile X syndrome. The disorder is also more likely to develop in a baby born to older parents. /r/n/r/n The use of certain anti-seizure drugs during pregnancy may contribute to the development of autism. Valproic acid is a known teratogen, a substance that causes birth defects, and can result in abnormal brain development. Exposure during the first trimester puts the child at the greatest risk of developing autism. /r/n/r/n There are many misconceptions about other causes of autism. Vaccines, for example, are one of the things that don't cause autism. /r/n/r/n There are no medical tests for either ADHD or autism. Diagnosis for both relies on observations, interviews, and assessments of development and behavior. /r/n/r/n Prior to making an autism or ADHD diagnosis, practitioners conduct tests and ask questions to rule out other possible contributions to attention issues such as anxiety or a learning disability. /r/n/r/n Evaluation for autism or ADHD is often conducted by a team of specialists, including /r/n/r/n At the evaluation, specialists use a variety of different tests to determine the person's intelligence quotient, IQ, speech and language skills, and behaviors. /r/n/r/n In most cases, autism and ADHD are diagnosed in young children. A healthcare provider or pediatrician starts the process by asking a series of questions about the child's development and behavior. If the screening suggests further testing is necessary, the pediatrician will recommend a full evaluation. /r/n/r/n Specialists may ask parents a number of questions about the child's development. They may have parents fill out questionnaires about their child's behaviors, growth, medical history, and more. They may wish to speak with teachers and other caregivers to help with the diagnosis. /r/n/r/n Because ADHD and autism have many overlapping symptoms, it is possible for a child with autism to be misdiagnosed with ADHD. It is also possible for a child with ADHD to be misdiagnosed with autism. /r/n/r/n Both autism and ADHD, particularly when mild, may be diagnosed in adults. Usually, the diagnosis comes from a psychologist or psychiatrist, though it may also come from a general practitioner. /r/n/r/n. While the diagnosis and causes of autism and ADHD may be similar, treatments are usually quite different. In part, that's because there are pharmaceutical treatments for ADHD while there are none that directly treat autism. /r/n/r/n. It's also important to note that autism, unlike ADHD, is a spectrum disorder. That means that there are people with both mild and severe autism, and severe autism can be extremely disabling. /r/n/r/n. There is a wide range of treatments for autism, depending on the individual's particular needs. The most common, however, include /r/n/r/n. Most people with ADHD are treated, at least partially, with pharmaceuticals to help decrease impulsivity and increase focus. These medications may be stimulants or non-stimulants, and the choice of treatment may depend on the age of the patient. In addition, treatments may include /r/n/r/n. Treatment for children with ADHD may take a team of parents, teachers, and family members to help provide structure and enforce acceptable social skills. Adult ADHD therapy can involve meeting with a professional counselor or therapist to help meet goals. /r/n/r/n. ADHD and autism are not the same disorder, but they may be hard to tell apart. In addition, it's very common for one individual to have both diagnoses. Treatment for the two disorders is similar but not identical, so it's important to get the correct diagnosis. /r/n/r/n. Both disorders typically are diagnosed in childhood by pediatric psychologists, developmental pediatricians, or other specialists. Adults may be diagnosed by a primary healthcare provider, psychologist, or psychiatrist. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.